Hello, everyone, and welcome to this session event this afternoon, which is being scheduled as part of the TUC Women's Conference. I'd like to welcome you all to this amazing set of discussions that I'm very much looking forward to. My name's Debbie Weeks-Bernard. I'm going to be the chair for the discussion this afternoon. I'm the Deputy Mayor of London for Social Integration, Social Mobility and Community Engagement. And I've got with me a group of amazing women who've got so much expertise and lived experience to share with us on this really important set of issues. So in London, I have a remit which spans a wide range of issues, but my remit in particular spans promoting equity and tackling inequalities, both for those who are covered by equality legislation, so all of those with protected characteristics, but also those who are not covered by legislation, so low-income individuals, migrants, care leavers, and children and young people who are in care. And that's because we know that these are groups of individuals who experience society in a difficult way, who require additional support and intervention to enable them to thrive and to progress in the way in which they are entitled to do so. So I'm really looking forward, as I've said, to what's going to be a hugely important and interesting discussion. It is one that doesn't very frequently form part of public narratives, yet it should do. And it's really unacceptable, as we all know, that Black women are 4 times more likely to experience a pregnancy-related death than white women, and that we still continue to face discrimination and barriers when seeking to access health services to which we are all entitled. We know that during this current crisis that huge inequalities have been opened up by it, but these are inequalities, health inequalities in particular, that existed prior to coronavirus and which have been widened by it and which will continue if we do not have a specific focus on ways to try to reduce those inequalities. And having discussions like this really help us to ensure that issues around unequal access to services, inequalities, inequity are not only informed by those with lived experience and expertise, but that they form part of our recovery out of this crisis. So to the discussion at hand. This is an open space conference. We want it to be a comfortable space for all of you who are attending. And the TUC Women's Conference, for many of you, you may know, is something that takes place annually every single year ahead of International Women's Day on the 8th of March. TUC as an organisation is really committed to organising activities in which everyone can participate in an inclusive and respectful and safe environment. TUC has zero tolerance for any types of harassment. So please be respectful of others and engage with understanding. I know that all of you who are on this call will listen to this perspective shared by others and will learn from those perspectives. We're really interested in hearing your thoughts and your views and your questions. So as we go through the discussion, please think of the questions that you might want to put to our panel. We encourage you to add your questions throughout the event. And this applies to starting from now and going up to the Q&A session that will come after each of our speakers have had an opportunity to share their thoughts and views and expertise on the issue at hand. If you'd like to post about the event, please use the hashtag TUCWomen. And we're also mindful, given I have spoken about coronavirus, that most people may be at home today and that interruptions might happen, and these might happen from children, from pets, from those around you in the home with you, and that is completely okay. Whether you're a speaker or an attendee, if you need to leave the session for a moment to step away from your computer or your laptop or your device, please feel free to do so. So after we've heard from each of our speakers, we're going to move to a question and answer session. So please submit your questions via the Q&A function, and we will seek to try to include as many of those questions as possible. Attendees can also upvote questions for the Q&A, and we encourage you to use this feature to promote questions that you think are important to cover. Okay, so I'm going to start by introducing our first speaker. Sandra E Gray is a social entrepreneur, a diversity and inclusion consultant, a speaker and maternal advocate, as well as a best-selling children's author. Sandra consults organisations and charities to better engage and impact Black and BAME mothers and families through running her social enterprise for the Black Motherhood Experience, the Motherhood Group. She's also a trustee for Birthrights Charity, and she acts as a maternal mental health advocate, campaigning for Black mothers to have access to adequate care in their pregnancy and beyond. Sandra, over to you.
Thank you so much for that. Thank you so much. Hi, everyone. That was such a grand introduction. I'm Sandra E Gray. As mentioned, I am a maternal advocate. I am an inclusion consultant, co-chair of the National Inquiry into Racial Injustice in Maternity Care. And I'm also the founder of the Motherhood Group, which is a social enterprise that delivers workshops and large-scale events interacting with thousands of Black mothers here in the UK. We pioneered last year the UK's first ever awareness week, highlighting the disparities of Black women's maternal mental health outcomes and issues, which was called Black Maternal Mental Health Week UK. We make sure that we raise awareness of Black maternal issues. We try our best to reduce the stigma of maternal mental health challenges within the Black community. And we also offer peer-to-peer support, free doula support, free counselling support, and we make sure that we deliver training workshops to healthcare professionals, higher education institutions, and other organisations so that we can ensure that Black mothers' voices are amplified, are recognised, and cultural competency is at the heart of their work ethos. We deliver national campaigns and we collaborate with decision makers to influence policy, and we co-produce the national research such as Oxford and Cambridge University to improve Black maternal mental health, as well as we create a safe space for mothers to chat, connect, and speak about the issues that concern us as Black British mothers. Why did I start the Motherhood Group? Well, 4.5 years ago, my life and my world was changed dramatically. I became pregnant with my first daughter, Zoe, who is a bundle of joy. She's 4 going on 14. But when I was accessing maternity services, I noticed that I wasn't treated with the care that I thought I deserved. I didn't feel like I was treated equally, and I didn't feel like my words were taken into consideration. I was very much aware of institutionalized racism at work and everywhere else, but I don't know why. For some strange reason, I believe that as a pregnant woman, I would be, I would be deemed as, different, special. I would be treated with care, respect, kindness, be spoken to with my first name, and, treated equally. But that was not the case for me, sadly. In my birthing experience, I had what I would call a traumatic birthing experience, which I don't want to go into detail too much right now. But what I can say is that I was definitely ignored. I was definitely dismissed. My words were definitely not taken seriously. And that left me scarred emotionally for a long time. And that's why I sometimes do still randomly well up when I speak about my experiences of giving birth. And that also led me to actually have undiagnosed postnatal depression. And I didn't want to speak about it. I didn't want to share with family and friends, especially didn't want to access healthcare services. And so actually I didn't get the support that I needed as well with my postnatal depression. And that's why I started the Motherhood Group, because I was very eager to create a safe space for Black women like me to speak about maternity services, to speak about the challenges that we go through, and also to have a community, because I did try to go and access care for a particular moment. I did try to go out and go to baby and mum groups, and I felt very much excluded. I didn't really see myself represented in these spaces. And so that led me to further stay in isolation and feel like I was being silenced. As everyone should know by now, Black mothers are 4 times more likely to have complications and die in pregnancy. We are more likely, 13% more likely to have postnatal depression, and also the least likely to have treatment for this as well. And actually, 2013, a study found that Black mothers were less likely to receive pain relief than white women. And that's the same that happened to me. I was refused pain relief in my pregnancy birthing experience. We're also less likely to have a choice of where we give birth. Likewise with me, I wasn't given that choice as to where I gave birth. And we're also less likely to report that we are being treated with kindness. I can, in fact, say that both of my pregnancy and birthing experiences, I didn't feel like I was being treated with kindness. So all of these stats, they all add up, and it fills me with so much anxiety and fear. And other Black mothers also do have so much anxiety and fear in their pregnancy and postpartum period, because we believe that if there is something going on, we can't speak out. And if we do, we're not listened to. So what's the point? Black and pregnant women are 8 times more likely to be admitted into hospital with COVID-19. What's going on? Why are we still going through these shocking statistics, going through these shocking experiences? And everyone's starting to finally wake up. When I launched the motherhood group 4.5 years ago, and I was trying to raise awareness, trying to speak about these key issues, I was being ignored. I was told that I'm actually discriminating by having these spaces for Black women, which was quite annoying, but most importantly, very frustrating. But finally, I'm really glad that we've gotten to a place now that people are speaking about it. People are more aware. People are starting to understand and look furthermore into these disparities. My work with the Motherhood Group and also co-chairing the National Inquiry into Racial Injustice in Maternity Services, we're hoping that these death rates can come down for Black women. They've gone down from 5 times more now to 4 times more, hopefully 3 to hopefully there won't be any more disparities. We are hoping that we have the right to be treated with dignity and respect, the right to have our body and our choices respected, the right to have adequate care. These are what I would call basic human rights that sadly a lot of Black women do not feel that we are entitled to. We want to make sure that decision makers are fully understood, aware of what racism actually looks like in maternity care. We're hoping that when we speak, we are listened to, and that also we start to what I would call trust healthcare services. For a long time, I didn't trust that stepping into a hospital, stepping into any form of a healthcare building, that I would be treated with care. We are hoping that healthcare providers stop stereotyping, and that we as Black women, Black mothers, start to know our rights, and we have more authority over our body and also more authority over our postnatal and pregnancy experiences. And we also want to know what good practice looks like, because I'm fully aware that other Black women surely have some, good experiences, good encounters with healthcare services. What does this actually look like? And how can we ensure that this is repeated and replicated throughout? So we need to make sure that good practice of healthcare professionals are implemented throughout. I just want to make sure that Black women have a voice, our voices are amplified, and that we are taken seriously here in the UK. Thank you guys for listening. My name is Sandra E Gray.
Thank you so much, Sandra. That was a really inspiring and uplifting, evocative presentation. And it's a good way to kick off the discussion. So thank you so much for that. I'm going to move to our next speaker, and that is Zenith. Xena Tidd is Head of Quality and Safety at the Royal College of Midwives. The Royal College of Midwives are a professional members organisation and trade union promoting midwifery, quality maternity services and professional standards. Zenith has been instrumental in leading RCM's work tackling inequalities in Black women's maternal care, tackling racism in the NHS, and RCM's work preventing stillbirths and neonatal deaths. Zenith, over to you.
Thank you, Debbie. This is a topic that's very, very close to my heart. And thank you, Sandra and Tanika, for the grand work that you guys are doing. As Debbie mentioned, my name is Xena Tidd, and I'm the Head of Quality and Safety for the Royal College of Midwives, and also for the lead for the Race Matters campaign. And just to give you a little bit of background about me, I've been a midwife for about 16 years, but prior to that, I've been in the NHS for 6 years, and 4 of those were as a student. So I've had about more than 20 years of a slog in the NHS. In terms of the Royal College of Midwives, it is working towards becoming a more diverse organisation in everything we do. So just to start off and giving you a brief explanation of what Race Matters is, it is basically a programme of work that was started by the Royal College of Midwives in 2018, and it's to tackle all of the issues that Sandra mentioned. It's the issues addressing inequalities and inequities going on in many parts of the UK. And those issues are affecting our maternity workforce and having an impact on the outcomes of the pregnant women who've been experiencing that service. The campaign itself is about delivering on all our 5 key pledges, and it's to empower, to listen, and it's to support, educate, and motivate each other to embrace the Race Matters agenda. So the Royal College of Midwives have committed to raising the profile of the Race Matters campaign to all of those that are working in the headquarters, to all of the activists who support the frontline staff. And we're hoping that this should start filtering out to our members, who will have the confidence to support the women that they care for and even challenge poor behaviours more productively. The Race Matters campaign is going to stay with us until we achieve true racial equality in maternity. And as you know, we still have a long way in going to ending this discrimination and ensuring that the world of work is fair and equal for all, and the care that given to every woman is equal for all. I think each and every one of us have an equal personal responsibility to get to the point where we have the knowledge and the skills to open the uncomfortable conversations about race. And it's about beginning to talk about it in a meaningful manner about how it affects our work, our lives, forever. Sandra mentioned about the disparities, and she touched on the figures as well. And the thing about racial disparities in maternal and newborn health, these findings have persisted for decades. The findings from the Public Health England report published last year and the Embrace UK report that was published late last year, none of it is a new phenomena. I mean, for people like us on this particular panel, being Black or brown can mean that you're more likely to receive disproportionate care and you're at more significant risk of having other adverse pregnancy outcomes. It's just unacceptable. I mean, these reports continue year on year, highlight the multiple and complex problems that these women who die in pregnancy in terms of their social, physical, and their mental health. And the data, as Sandra picked on, was that Black women are four times more likely to die in childbirth than are white women. And Asian women are 2 times more likely to die. And although I know that there is great efforts going across all 4 countries to try and reduce these disparities, definitely more needs to be done. I mean, I find it so disappointing, so disheartening, and so terribly sad that year on year that there's been very little improvement in terms of reducing these figures. And it's not rocket science to tell you that behind each figure, each statistic, that there's distraught families out there, or even sometimes a baby having to live without their mother. I mean, these lives have been changed forever and, you know, to say the least, not for the better. I mean, my question has always basically been that is the unconscious bias amongst clinicians playing a part towards these devastating figures? And Sandra again touched on the elements of research in terms of women from Black, Asian, minority ethnic backgrounds sharing their experiences about birth. We've got so much research out there in terms of the variation of care that these women receive. So again, Sandra touched on pain relief. You know, because obviously, you know, she's perceived as being maybe strong or just being perceived as actually she's not worthy. You know, women who wear hijab are given less options in terms of their care. Women who have limited capacity in terms of understanding and English have obviously less likely to receive better care. So we know all of this. And one of the pledges I was talking to you about at the start of my my talk is that the Royal College of Midwives has committed to supporting research and championing positive change in outcomes for people like ourselves from our particular backgrounds. I also just want to quickly, briefly touch on my own lived experiences from a worker's perspective. And I've written a few articles of my experiences as a midwife about the racial discrimination I've encountered by some during my working career. And some of it was really obvious, and other incidents would be more indirect and very insidious. And that's happening within the NHS. So if it's happening to workers, I can guarantee you, as Sandra has already pointed out, it is happening to our, to the women coming through our services. I am one of many individuals in the NHS who have been sidelined. I've been isolated, and I've experienced the pain, the loneliness, the sadness, and I know firsthand how it feels when you're on the receiving end of this particular hate. And as you know, education and raising awareness in these cases is key if you want to stamp this disease out for good. So it's using various platforms like these particular great events to get the message finally out there that this is completely unacceptable and positive change is coming, and we all have to stay united to achieve this once and for all. Thank you.
Thank you so much for that, Xena. And thank you also for adding in that perspective as a person who works within the workforce to really sort of exemplify and demonstrate that if there are experiences that people are having when trying to access care, it also reflects the sorts of experiences that people are having within that workforce, and that there is discrimination across every level, and it's really important to tackle it at every level. So thank you so much for sharing that with us. Can I remind all attendees, please start putting your questions in the chat function. We really do want to hear your thoughts and views and any questions that you might have for this really great panel. It's a really useful opportunity to discuss something that never really gets discussed enough. So please do put your questions in the chat so that we can pick them up after our final speaker. And to our final speaker, last but by no means least, goodness, put my teeth back in. I'd like to introduce you all to Tanika Arway. She is a co-founder of the campaign group 5 Times More. 5 Times More is a grassroots organisation committed to changing Black women's maternal health outcomes in the UK. It was initiated in 2019 when Tanika and Clotilde, Rebecca Arbe, who was the other co-founder, when they both came together with the dream of improving maternal mortality rates and healthcare outcomes for Black women. 5 Times More is dedicated to supporting mothers with its campaigning work and recommendations. Tanika focuses on empowering Black women to make informed choices and to advocate for themselves throughout their pregnancies and after childbirth. Over to you, Tanika.
Thank you so much for having me. And just as you were introducing me, my daughter woke up from her nap, which I knew was going to happen. So I do have a presentation that I would like to give, and I'll wait for the slides to come up. Okay. So 5 Times More. We are addressing Black maternal disparities in the UK. Next slide, please. So what is 5 Times More? As Debbie mentioned, we're a grassroots campaign committed to highlighting and changing Black women's maternal outcomes in the UK. Number one, highlighting. It's really important to highlight because a lot of people don't actually know that this is something that's happening right now in the UK. Whenever you hear the statistics, you always think that, oh, it's something that happens in America, or it's, something far away, oh, that can't be happening here in the UK. But actually, as someone so rightly said before, this has been going on for decades. This has been going on for a very, very long time. So we are committed to highlighting and changing the outcomes for women. And I'll tell you a bit more about how we do that in the next couple of slides. Next slide, please. How we started. Okay, so that's me pregnant with this one in the picture. But how we started, I have a son, he's 3 years old. I gave birth to him in 2017. And my experience of giving birth to him I won't go into the exact details, but I had preeclampsia that was diagnosed late, which led me to be induced, and I had a very traumatic experience, which led me feeling like I wasn't listened to, like my pain wasn't taken seriously, and like I didn't matter. I also run a group called Mums and Tea, and like Sandra, you know, I felt like I was the only sort of Black mum in all of these groups, baby groups, mum and baby groups. And what I found is I started to build a community of Black mums around me, and we started doing meetups. And the more I spoke about, you know, my experience giving birth to my son, the more I realized that actually this is something that a lot of us are feeling. A lot of us are feeling this way. My experience wasn't an isolated one. So when the embryo statistics came out in 2018, I was shocked, but I wasn't surprised to hear that Black women were indeed 5 times more likely to die. And I'll try to put this into perspective for you. Black women only account for 4% of births, yet they are 5 times more likely to die in comparison to a white woman. And something just didn't sit right with me. So I joined forces with Chloe. That's my co-founder there on the side. She runs Prosperities, and she supports Black pregnant women throughout their pregnancies. And that's how we decided to start 5 times more, because we wanted to scream and shout about it, and we wanted to do something about it because it's wrong. And, you know, we have loved ones, and we know that we just don't want them to face the same outcomes. So next slide, please. So what do? We empower our mothers with our 6 steps, which I'll go into in a little bit of detail in the next slide. But we also offer Black women, every month we give 100 Black women access to a free digital preparation course for birth. We educate. So we've also teamed up with the RCOG to offer 5 steps for health professionals to take when they are dealing with all women, but of course Black women most especially. We give talks to university students. We raise awareness via social media. So we've got our 5 times more selfie, which the lovely ladies in the picture on the side are doing. And that 5 times more selfie is to highlight that we are indeed 5 times. I continue to say 5 times. I know the number did go down in the last Embrace report to 4, but it's important to note that that number is actually not statistically significant. And yes, we welcome the reduction. Of course, every life is important, and any reduction to that statistic is something, but it's actually not statistically significant. So we continue to say 4 to 5 times more, or 5 times more. We amplify, so we seek to amplify the voices of Black women. We tell their experiences, both good and bad, because we know that people can learn from it. And also, there are good experiences out there. I myself, for one, my daughter was a really good experience giving birth to her, even though I gave birth to her in the middle of the first lockdown and the pandemic last year. It was a very positive experience. So we do want to highlight that and learn from those experiences as well. And finally, we lobby. So we had a petition last year that gained over 187,000 signatures within a week, which was, you know, phenomenal to get the support of people. So we are waiting for a debate date in Parliament. Obviously, because of COVID, things are a little bit slow, but we have actually given written and oral evidence into Parliament as well. And we have an MP letter writing campaign, and we implore people to write to their MPs about the statistics and what their MPs are doing to try to change that. Next slide, please. So here are our 6 steps that we recommend for women. I won't go into all of them, but I think one that we always try to say to women is, you know, to speak up. Speak up if you feel like something isn't quite right. Speak up if you have any questions, and speak up if you feel like something just, you know, is wrong, basically. You'll be surprised to hear how many women were like, oh, I didn't know my rights, or I didn't speak up because I didn't feel I could. So we implore women to try to speak up. And in turn, with our health professional steps, we ask, health professionals to listen. You know, we're asking the health professionals, if the women are speaking up, health professionals, you need to listen, not listen to how it's being said, but what is actually being said. We've got another one here, is do your research. I think that's really important. Know what to expect when it comes to pregnancy, childbirth, labor. Know your rights, know what you can and cannot ask for, know, you know, basic things, the human rights, and so you know how to advocate for yourself, basically. Next slide, please. I do have some quotes here from some Black mothers. I think it might be too small to see on the screen, but basically there are so many examples of women who have taken the steps from our campaign or have taken the digital preparation course and have ended up having really positive experiences, which is what we are here for, is to help women advocate for themselves so that they can in turn have more better experiences giving birth. Because of course, as you know, if you have a traumatic experience in the hospital, it doesn't just end there. This is something that can travel with you, you know. An example of that is when I spoke to my mother about her experiences giving birth to us, when she was recounting it, trauma stays with you. It's almost like she was reliving it as if it happened yesterday. So if you're having bad experiences, those things can stay with you and they have knock-on effects. Like Sandra was mentioning, we have higher levels of mental health, and we're less likely to get the help for that. So I think these things are all interlinked somehow. So we are very pleased that, you know, through our campaign, some women are reporting better experiences and are having safer outcomes. Next slide, please. So this is how you can support us. You can take your 5 times more selfie on social media. You can write a letter to your MP. You can donate to our fundraising campaign and continue to spread the word and help us to spread awareness. There are contact details, and I am Tanika. Thank you so much for listening.
Thank you so much, Tanika, for that. That was wonderful. I know, I'm hoping that everybody will have seen all of the information that was on your last slide, so they know how to get involved. But I am sure that TUC staff on the call can share that with attendees afterwards if they want to get in touch with your really amazing organisation. Can I thank all of you for your initial really stirring comments, and you have been generating some questions that I'm going to start putting to you all now. To kick off, the first question is for each panelist, but I'm going to put the question to Sandra first, then to Tanika, and then to Xena. The question is, what can women do who are watching this? Black women, but crucially allies, white women also. How can they get involved in supporting your work? So Tanika, you've already talked a little bit about that on your slide, but also in pushing this issue to the priorities of government and of NHS trusts. That question, if I start with you, Sandra, first.
Yeah, so it's basically been already reiterated throughout. Simple things like listening to Black women's voices, brown women's voices, and taking their words seriously. So often we've had a long history of our words not being taken seriously and being ignored throughout. Just start to listen. In terms of actual, physical support, definitely take part in the campaign. So, we're having Black Maternal Mental Health Week, Awareness Week this year. Take part in the campaign, spread awareness, share content, speak within your organizations about some of these disparities. We offer training courses to healthcare professionals and organizations who want to better understand the Black maternal experience. And so a lot of the times, of course, it is institutionalized racism, but also unconscious bias, not really being culturally competent, not understanding, some of the differences that Black and brown women go through and how this impacts their overall experiences of being pregnant and giving birth here in the UK. Start to treat us with kindness. Some of my mums have reported back to me saying that they had gone to their appointments and they just felt like they wasn't even treated with kindness, a smile, looking into their eyes, saying their first name, how was their day? Little simple things like that goes a long way to make our experiences accessing maternity care so much better. And of course, without finances and resources, a lot of work can't be done. So please do donate to causes that definitely do, highlight these disparities. We also have the Black Mum Support Fund that we are crowdfunding campaign that also helps to give Black mums that can't afford it doula support. If I had known about a doula, I would have definitely accessed one during my pregnancy and postpartum experience. I didn't feel like I had the strength nor the knowledge at the time to advocate for myself. And so my poor husband was saying, please listen to my wife. And he didn't know how to properly articulate, what I was going through. So please, if you can support by donating to the Black Mum Support Fund to ensure that Black mothers can have access to doula, and also prenatal and postnatal counselling, so that we're able to, go through the trauma and understand and get the support that we so rightfully need. And of course, importantly, knowing our human rights. If I had known that I was actually entitled to pain relief, I would have, used the correct language to make sure that I had what I absolutely needed, which was pain relief at the time.
Thank you so much, Sandra. And same question to Tanika.
Thank you. I think it's a great question, and I don't want to sort of echo what Sandra has already beautifully said, but I definitely think one of the most important ones is listening. And one thing that my co-founder Chloe says is making Black women the center of their care. So it's about individualized care. It's not a one size fits all, one size fits no one. And what we need to be doing is listening to the women and making them the center of their care. I think getting to know that woman, getting to understand her. Yes, you may only, when it comes to, if you're a healthcare professional and as a woman presents in labor, you may only have a restricted amount of time, but you can have so much impact in that time that can then empower her and make her feel like she can do this, as opposed to being dismissed, making her feel like her voice doesn't matter. I think making women the center of their care is very, very important. And there are so many other grassroots organizations that you can support that are on the ground, that are doing the work and supporting Black mothers. There are a few, sorry, they've escaped me now, but there are other organizations that you can support the work of. So yeah, again, I don't want to duplicate what Sandra has said, but I definitely echo all of that.
Thank you so much, Tanika. Yes, heard loud and clear. There's going to be a lot of similarities, I think, in what you're all saying today. But thank you, because you added to what Sandra said so beautifully. So Xena, same question to you.
Yes, thanks. So there will be a bit of an overlap, but it's really important we spur that collective effort to turn the intent of many to change into real, meaningful actions. And the solutions always start with strong leadership, in which we motivate, support, inform, and enable all coming forward. And this is not about Black versus white. This is about everyone against racists. I would say it's about looking within yourself at every step, at every encounter you have. Think about your own actions. Think about whether there is an unconscious or even a conscious bias with your thoughts, with your speech, with your actions. And I've read an interesting quote previously, and it goes something like, yesterday I was clever, so I wanted to change the world. And today I am wise because I'm changing myself. And there's a lot about that in itself in terms of hopefully making a change for the better. I'd say it's then about looking at what your trust or employer is doing and challenging them when they fall short. it's about getting involved. So I would probably say, you know, I don't know whether your viewer is part of a union similar to the one like Royal College of Midwives, and become an activist. It's really important to take these issues that matter to you to the employers and challenge them when you think that they are failing short. The other thing I would say is consider becoming a trust board member so you can have a direct impact on this. And if you do become one, make equality a key focus of the work that the trust actually is doing. And as Tanika mentioned, you could also write to your MP as well. Just, I would say the key thing is it's all about having a unified approach. We are all together in this to try and stamp this disease out.
Thank you. So thank you, all three of you. Really, really, really great answers to that question. And thank you to the attendee who posted it. So we've got another question in. This question is mostly for Zenith, but Tanika, Sandra, feel free to come in if you'd like to. So question says, my personal observation and from a nursing background is that Black women are often compromised, I think that says, in the birthing experience, treated like they're on a factory conveyor belt, moved into having a cesarean. It would be good to know if there's any research that's been done on this particular, whether or not this is a trend, and if so, what are the stats?
I am not familiar with that particular that experience or what you've just mentioned, but if there is, because obviously you've just thrown it on me. I mean, my experience generally, or my observations as a midwife, has been very much that they're not necessarily always thrown into having a cesarean section. I would say if there is, if you could leave your number or your details, I could do more research to see if there is anything specifically out there. But I have heard other stories that are completely the opposite, in terms of when they have tried to want for a cesarean section, they've actually been dismissed and told that vaginal birth is actually the only way for them, despite the numerous risks that are associated for them. So I don't know about the that particular research that you've referred to, but the ones that I am quite familiar is the one that where they've not been informed about their options when it comes to C-section and given the choice if they want to have a C-section based on the risks. For me, this is a quality and safety issue. And again, as I say, you know, this is, I mean, we've already pointed out, it just needs to be addressed and speaking up about it. And but I think, I'm not sure if Tanika, I can see you nodding your head about what I've just mentioned, and I don't know whether you want to just kind of follow on from what I've said.
Sorry, I was nodding because I was like, yes, speaking up is really important. Yeah, I don't think I can comment because I'm not really sure about C-section and research, so I don't think I'm best placed to answer that. But yes, thank you.
I do know that in America, African American women are more likely to have C-sections, but I'm not too sure about the UK. And I have heard many other Black women saying that they were suddenly rushed and had to have an emergency C-section. So that could be because of the racial disparities that we go through and not being listened to up until the point where suddenly they have to have a C-section. But definitely more knowledge around, knowing our rights, knowing what options there are needs to be a factor considered here. But I can't speak more on that on the UK perspective.
I'm sure that there is something there, but as I say, because obviously he's just kind of been lumbered all of a sudden. Like I say, if you want some further details, you can contact me, or as I say, you can leave your details and I'll get back to you.
Thank you, Xena. And I think you all picked up that generally, I think this is reflecting that theme, which is around the lack of women feeling heard and being listened to. So whatever it is that you are requesting or you need in that experience is not necessarily always heard or responded to positively. So it may be that experience that the attendee is referring to is just about a woman finding herself in a situation that she did not ask for, but her views were not taken into consideration. But thank you, all three of you, for the answers to that. We have another question. This is for any of you to answer. So what would you like to see the healthcare unions, whose members are midwives, clinicians, doctors and nurses, pledge to do in order to give Black and Asian women better experiences and change that 4 to 5 times statistic? Are there policies or training you would have recommended we insist those organisations implement? Who'd like to jump in first? Okay, I'll ask, because I started with Zenith, I'll start with Sandra. Sandra, have you got a view on this? Sorry to pick on you ladies.
Yeah, so definitely a lot of work needs to be done around cultural competency. Absolutely. In fact, we now we've started doing training for healthcare professionals on to better understand, the experiences of a Black British mother, and also how this might play out when she's accessing maternity care. The notion of, Black women being perceived as supernaturally strong, we can bear all on our shoulder, how that now needs to be dismantled because that's now killing us, definitely, and how also culture, traditions also play a massive part in how we access and how we receive care. Our understanding of mental health, why we're less likely also to have follow-up treatment. So many other issues that need to be taken into consideration when we are looking at Black and brown women accessing, and then some of the barriers that play into part